This is Melissa Jager, and this is my PowerPoint presentation for IDS 400 titled Diversity, Low-Income Pregnant Women and Diversity. I'd like to talk about a population facing diversity today. Low-income pregnant women, especially minorities and immigrants, face many obstacles. The disparities between low-income women and those of greater economic means concerning access to prenatal care and personal treatment at facilities are great. Early on, nurses recognized the benefits of prenatal care to women of lower economic status and immigrants and encouraged mothers to seek medical care during pregnancy. Legislation has been put in place over the years, including most recently the Affordable Care Act, but unfortunately disparities continue to exist. This population of women are often also subject to racism based on their financial status. Later on, I will talk about how the disparities contribute to poor outcomes and mistreatment. Impact on society. Low-income pregnant women have made impacts on society, both past and present. In the early 20th century, large disparities between the poor and wealthy prompted the foundation of public health nursing. Nurses pushed for better care for these women. For example, in 1921, nurses helped to introduce the Shepherd-Tanner Act, which provided grants and services for maternal care. The introduction of the Social Security Act of 1935 also opened the way for funding of maternal health projects. The two pieces of legislation were found to reduce complications, maternal mortality, and led to 1/3 fewer infant deaths and stillbirths, which have made an impact on our society. Most recently, the Affordable Care Act has allowed low-income women to receive Medicare services, and there are pending bills in Congress and efforts to improve care in the prenatal period. Infants born preterm are more likely to have chronic health issues and therefore require multiple hospital stays. Some of these health issues are infections, asthma, sudden death infant syndrome, also called SIDS, impaired learning, and also they found that the lack of care can lead to cases of cerebral palsy and infant death before the age of 1. Some other consequences are preterm birth, low birth weight, stillbirth, and lifelong disabilities. Providing prenatal care to these low-income women reduces NICU admissions, which saves approximately $1,768 to $5,560 in cost per births. Offering access to care can help eliminate the need for lifetime medical costs of a disabled child. This affects society because for those without insurance, the taxpayer or hospital is footing the bill for the health care costs that could have been avoided with prenatal care. Long-standing social disparities have impacted these women. Minorities may find that they have restricted access to social resources and underinvestment in their communities, which prompts the development of unhealthy social and physical environments. Lack of providers in these low-income areas are also a barrier. The few that are present are overloaded and they cannot take any more patients. If a pregnant woman cannot schedule a visit, how is she to get prenatal care? If one calls an office or two and can't get an appointment, it may discourage them from pursuing care any further. Despite attempts to improve care by the government, recent legislation passed by the current White House administration has mandated immigrants be in the U.S. for at least 5 years before becoming eligible for services, excluding a portion of this population from care. Other programs, such as the Temporary Assistance for the Needy, called TANF, have also had setbacks due to budget cuts. Some more society impacts continued. Some of the states' refusals to adopt the new Medicaid expansion mentioned above in the ACA have a lack of coverage options and services for the uninsured low-income women or persons. These setbacks have made a harmful impact on families of color who are overrepresented in these programs due to barriers to economic opportunity in this country and can be contributed to racial structuralism. Racial disparities have long also played a part in care for low-income pregnant women. Low-income pregnant women often suffer from stereotypes and humanities through their portrayal in the arts like movies, books, social media, etc. These women are often portrayed negatively with damaging effects. They are more often to be viewed as a single woman of color rather than a white woman, and as a Jezebel that takes advantage of public assistance. There is evidence that shows that pre-existing racial notions do, whether consciously or unconsciously, affect the attitudes of healthcare workers in regards to these women, which contributes to health disparities. This does not help the fact that low-income women of color, especially African Americans, have a higher rate of adverse birth outcomes than their white counterparts. In the literature by Alhusen, 2017, the women had experienced blatant racism, including racial slurs and treatment based on financial status. These elements lead to stress, which increases a poor outcome in their pregnancies. All the research I've gathered on diversity low-income pregnant women face, especially minorities, have opened my eyes to the many issues that they face. I did not realize the extent of lack of care and barriers that they face. The fact that it leads to poor outcomes is upsetting. Personally, I had my children in a brand new maternity wing that was state-of-the-art. It had private birthing rooms with the latest gadgets and equipment, and even had flat-screen TVs and DVD players with a library of movies and shows to watch. And it was almost 100% covered by insurance besides a few copays. At the time, I did not put much thought into the fact that my lower-income counterparts are not so lucky and did not get to have the wonderful birthing experience that I had experienced. The knowledge I gained from my research has influenced my professional life as a nurse. I am not a labor and delivery nurse, but the fact that not everyone has access to quality care in any aspect, even well visits, needs to remain on my mind. I have to remember not to judge patients, for example, for not taking their medications. It may be because they did not have the means to afford it or could not get an appointment with a doctor to have it refilled. I need to remember to have compassion for all my patients, regardless of their economical status. In the next 5 years, diversity research can impact my form and inform my understanding of my profession, and in the years to come. As the current healthcare crisis in our nation escalates, there may be more and more people that can't afford access to quality care. The recent COVID-19 crisis has also affected many people financially, which may have far-reaching consequences into our future. Studying diversity has renewed my interest in advocating for better legislation that ensures coverage for all persons in need. It has also renewed my interest in community nursing. I would like to volunteer at a clinic or a mobile health unit. Donating my time and services, along with the encouragement of my colleagues to do so, can help improve access to care. Studying diversity also makes me a better nurse and gives me the tools to do so for the span of my career. Open-mindedness is a must to be a good nurse, in my opinion, and remembering the issues others face can help me remember that. Society and interaction. Critically analyzing diversity is helping me to be a better person. I am now more mindful not everyone has had the same opportunities as I have had due to their economic status or the color of their skin. I realize I am lucky that I've had the opportunities that I've had in my life. Studying diversity has also helped me be more aware of harmful slang, jokes, and content on movies, books, social media, etc., whether it is consciously or unconsciously inserted. I also now have a new understanding why protests are being organized, such as those by Black Lives Matter. The aspects of life that are affected by diversity to minorities and immigrants are tenfold. Real change is needed, and we all need to work together to make this happen. I have come up with some strategies for my personal and professional goals. I plan to personally support causes that are inclusive and focus on the good for all. I plan to continue to teach my children diversity awareness and the need for inclusion of persons different from them. Some things I can do professionally are suggesting the formation of a diversity council to combat issues on my nursing unit. I need to determine what barriers my patients may face due to their race, ethnicity, or disability. I need to ask myself internally, when new processes are put in place in my nursing unit, is it inclusive? Does it discriminate discriminate against someone's skin or color or disability. Diversity training is another strategy professionally that my unit or hospital as a whole can benefit from. Research has shown that diversity training can help people be more accepting of one another. It also helps groups interact with one another, and it helps to change the beliefs that some people may have. This type of training can be used in any type of business, schools, and in the community. Some strategies related to low-income pregnant women are to know what resources I can direct them to if asked, and to remain current on the issues that they are facing. There are benefits and challenges to addressing diversity. Addressing diversity can make real social changes socially and improve the way we interact with one another. Historically, low-income women benefited from nurses addressing diversity they faced. Nurses advocated for legislation that provided funds for prenatal care for these women. Another benefit is addressing why one group is different from another. This can help people be more accepting of one another. However, despite social advantages and social acceptance of diverse groups, there are still challenges. While legislation has passed to improve care for low-income women through the ACA, some states decided not to adopt it, limiting resources for these women. The unfavorable portrayal of low-income pregnant women from media, as mentioned before, like television and film, can affect the attitude of healthcare workers towards these women. They have been portrayed negatively, most often a woman of color that takes advantage of public assistance. In conclusion, the presentation has shown that the diversity that low-income pregnant women, especially minorities, face. Preconceived notions from the media, including movies, etc., do not help and can affect attitudes and bring additional challenges for this population. Awareness of diversity, not just for these women, for all groups that face diversity, can benefit society socially and professionally. We need to think about how we treat other persons. If diversity can be avoided through knowledge, it would be of great value. The end.